The one big factor here is, do these efforts really save money? Right? After all is said and done, do they save money? The principal endpoint outcomes here were clinical improvement, satisfaction, and cost savings on a per beneficiary per month basis. I'm going to share with you data and report back on the financials from CMS, and then I'm also going to share with you subsequent findings as well. One of the things that was discovered by the independent evaluator at the 6-month mark was anomalies within the randomization process. And so this trial was randomized for things like dual eligibility comparability of the population, the time in which the randomization was done to the time the program started. Did people have heart failure and diabetes? A big emphasis was put on that HCC risk score. And at the time that the 6-month report went to Congress, independent evaluator noted, this is really important, that one of those key endpoint items was not in a comparable fashion between the control and the intervention group, and that was the cost per beneficiary per month. You think about that. That's one of the key findings that has to be understood here. At that time, a mathematical correction was made, focusing on trying to restore some comparability of the cost basis of these population. And it's with that correction that you'll see the data reported. That's all done by CMS and their independent evaluator. And all of that pans out inside of the work that we were doing, except for even post the mathematical adjustment, we found that the per beneficiary per month is way off to the right. Plain English, these groups were not comparable even after an adjustment was made by the independent evaluator on a comparative basis. Now, we could all go home and say, isn't that too bad? We're really never going to know the answer of what happened here. That's not in our nature. It's certainly not from a standpoint of knowing that all the other indicators that we looked at were positive, but we want to understand what the truth is here. That had our science team panning the globe to say, if you have this situation where retrospectively you want to be able to compare on an item and an endpoint in a control trial like this where you've lost randomization, how can you get that restored? And we want to use the method that's not our favorite method, but the one that we think most reliably, credibly, validity-wise, will allow for the comparison to be made.